Anxiety disorder is ultimately a trick. What do I mean by this? What I mean by this is that you may have had a bit of a traumatic experience. You may have been overwhelmed in a certain point of time, and rightfully so, you responded to that situation and circumstance with fear. Now, how we fall into the cycle of anxiety disorder is we have a maladaptive response towards it. And ultimately what fuels fear, what fuels anxiety is the fear and the anxiety itself. Fearing the symptoms, like not increasing your tolerance for discomfort. And this is ultimately true, guys, that we need to reinterpret our interpretation to anxiety, and that is the way forward. When you realize it is a maladaptive response that you have, and this is the framework, this is the groundwork of cognitive behavioral therapy, when we say we need to learn how to respond to things differently. And not only do we need to respond to it with acceptance, to embrace it, to let it just ride the wave of fear and anxiety. As Claire Weekes didn't specifically say that, but she does say how you can use sort of like a floating technique. So it's ultimately practically getting comfortable in your anxious discomfort. I remember when I first started to test myself and obviously go out and about, and after I was went down bad because of anxiety, because I didn't have the right information. I remember getting in the circumstances that I was putting myself in to obviously make myself of course able to go out and stuff, and to use this, apply this information and everything else. I was focusing on making sure that I was as comfortable as possible in my anxious discomfort. And this is the way forward, guys. This is ultimately the way forward, and your recovery is ultimately down to you. It is ultimately down to the decisions or lack of decisions that you made in the past. Yes, it wasn't your fault that you fell into this anxiety disorder, but it is your responsibility to get out. And I truly believe that recovery comes from within. Of course, there's things outside that I wouldn't have been able to recover from if I didn't have like support. The sun is really bright. If I didn't have like the right support and everything else. And so as we learn to go into the circumstances and situations which make us feel anxious, and we apply the information, that's like almost like a bicep curl for nervous system desensitization. We are trying to desensitize our nervous system, and it is ultimately down to this. It's not a mental illness. It's not a mental illness developing. It is simply a nervous system that's been sensitized for too long. And once we realize this, once we take it in, we can, that is like what starts recovery. It's like, wow, there's actually an answer to this. Many times I went to the doctors back and forth over, a couple of years, going back and forth on medication, and they put me on antidepressants. I was on them for 3 weeks. I chucked them in the bin because they were just, they didn't do anything really. They didn't. Of course, I supported it in some circumstances, but as Dr. Harry Barry says from Ireland, he says that, we should not be prescribing people with anxiety disorders with drug therapy. It's not inducive of, it's not related to anxiety recovery. So guys, that's all I've got to say. But if you've got any thoughts, please put them down below, and comment, like, and share, and subscribe. Thank you all for the support recently on the channel. I hope, guys, this can help just one person. This is the information that I've gathered and everything else, guys. So God bless. I'll see you guys in the next video.